platform Swiss Liver Patients Association Swiss HEPA. Today with the interview by Professor Dr. Annalisa Berzigotti, Senior Hepatology at the Inselspital Bern, at the topic cirrhosis. Welcome, Professor Dr. Annalisa Berzigotti.
Thank you very much, Mrs. Bobson. It's really a pleasure to be here today and discuss this important topic.
My first question, what is cirrhosis?
Liver cirrhosis is the end stage of all chronic liver diseases, and it is characterized by changes in the micro and macro anatomy of the liver, which is characterized by nodules of regenerating hepatocyte surrounded by very thick scar tissue, which in hepatology we call fibrosis of the liver, which is a long-term reaction that is a consequence of inflammation due to any of the chronic causes of liver disease. For instance, alcohol, viral hepatitis, autoimmunity, or other causes.
How long does it take to develop cirrhosis?
It takes long to develop cirrhosis usually. For the main causes, we usually observe the development of cirrhosis after 20-25 years of the diagnosis of the beginning liver damage, let's say. However, one has to know that there are situations when cirrhosis can develop in a quicker way, usually, however, always in terms of years, not of months.
How common is liver cirrhosis?
So liver cirrhosis is not one of the commonest causes of chronic diseases. However, it is also not rare. It is estimated that it affects around 500,000 people in the world. What is important to know is that mortality associated with liver cirrhosis is relatively high, and it is calculated that every year in the world, or at least in Europe, liver cirrhosis kills more people than breast cancer, for instance. So it is something that is important in terms of mortality.
Wow, that's a lot. Who is at risk?
At risk of liver cirrhosis are all people that have a chronic liver damage. For instance, people with a chronic hepatitis B or C, with alcohol overconsumption, with also metabolic risk factors that are something that not everybody knows, but we know nowadays that being overweight, obese for a long time, or having diabetes or arterial hypertension leads to an increased risk of liver cirrhosis. And there are other causes of the disease that are less common, for instance, genetic liver disease like hemochromatosis or Wilson's disease, or cholestatic autoimmune liver diseases, and these are already checked by the family doctor or can be checked in the liver clinic if patients are referred.
How can I protect myself?
You can do a lot to protect yourself. First of all, is being aware that there are some behaviors that can be changed and that are main risk factor for cirrhosis. So for instance, reducing or avoiding alcohol consumption is certainly something protective for your liver health, and maintaining a healthy body weight, not overweight and not underweight, is important. There are other things that you can do, like, for instance, drinking coffee and tea, which are protective for liver health. So avoiding alcohol and drinking coffee instead could be good for your liver, and doing regular physical activity. All these are behaviors that in general reduce the risk of progression of liver fibrosis, and so they reduce the risk of developing a liver cirrhosis. And they are also good in people who have already liver cirrhosis.
What can be done if cirrhosis is suspected?
So, first of all, cirrhosis is suspected by the family doctor, usually, that sees some abnormalities in lab tests. Usually the family doctor asks then a consultation in a liver clinic, so in a pathology service or in a gastroenterology service, where we make some steps forward and we look for an ultrasound of the liver. That is always the first important step that has to be taken when there is a suspicion of cirrhosis. And we can take a measurement of liver stiffness. The cirrhotic liver, due to the amount of scar tissue that is contained has an increased stiffness, and this can be sensed by simple elastography tests with the so-called FibroScan. Sometimes it's not enough, and we have to go further with some invasive tests like liver biopsy or measurement of pressure in the liver veins or endoscopy. So this has to be decided by the hepatologist.
How can cirrhosis be treated?
So unfortunately, nowadays, we do not have any specific treatment to reduce scar tissue in cirrhosis. So let's say in general, cirrhosis per se cannot be treated. But what we can do is treating the causes that led to liver cirrhosis. And sometimes it is enough to stabilize or even reverse the problem. We can definitely also control and change the cofactors of disease like obesity or underweight we discussed. And then what we can always do is treating the complications if they are already there. Sometimes it is needed to discuss a liver transplantation because in extreme cases when complications are very much advanced, only having a new liver available is the solution for this patient. This is, however, only in a part of the cases and not in all of them.
And is there any information about liver cirrhosis?
So there are many new studies ongoing to try to reverse liver cirrhosis in specific causes of liver disease, not in general, not yet in general. We hope that in the future we will have new medication able to reverse fibrosis, but it's not yet the case. So nowadays, the information you can have is that you need to be checked every 6 months if you have a disease with not yet complications. You need to be well informed on what you can do for your health, and you will have your brochure. The brochure we did for the Inselspital will be also available in the website. And you need to be followed up by people with enough experience. This is important because in some occasions there is need of specific intervention and specific medication for the complication that are not easily managed by non-experienced centers. So this is important, I think.
Okay. And last question, as a specialist, what do you recommend or advise patients with cirrhosis?
As you could maybe listen in also my presentation, there are many advices that are useful, I think, for patients. The first thing is being aware of what is your disease in order that you get a bit of control on your own situation and you can help us to better treat you because your behavior in the day by day can change really the natural history of the disease. So this is the first thing. Then what I recommend is to being very careful in having a medication list always available and updated for the visits, and to be aware that you should not take any new medication without medical advice. And this also holds true for natural substances or plants or things that you can listen about. Please just don't take these natural remedies without consulting your family doctor and, in case, the hepatologist. It is also very important that you avoid painkillers like ibuprofen or naproxen, these non-steroidal anti-inflammatory drugs, because they are really dangerous in liver cirrhosis. And so don't take new medication without getting in touch with us. And especially avoid absolutely alcohol consumption. This is key to avoid the progression of the liver disease.
So thank you very much for this very understandable and helpful interview, which is an additionally important source of information for patients. Thank you very much, Professor Berzigotti.
Thank you very, very much.